Every 1 in 4 Americans experience mental illness. That's 61.5 million people. Every 1 in 17 Americans live with serious mental illness. That's 13.6 million people. Mood disorders, such as depression, are the third most common cause of hospitalization in the U.S. for both youth and adults. Suicide is the 10th leading cause of death in the U.S., more than homicide, and the third leading cause of death for people between the ages of 15 and 24. More than 90% of those who take their lives had one or more mental disorders. 20% of people between the ages of 13 and 18 are diagnosed, and 13% of people between the ages of 8 and 15 are diagnosed. These statistics are per year. These are our people. These are Americans. Many new lives are being taken and wronged. The roots of the Diagnostic and Statistical Manual of Mental Disorders can be traced back to World War II, when there began a large increase of the involvement of U.S. psychiatrists in the selection, assessment, and treatment of U.S. soldiers. General William C. Menninger teamed with the World Health Organization to publish a book to help psychiatrists with standard diagnosis. After many revisions, the DSM version 1 was edited and later published in 1952 as the first book that described mental disorders in order to help diagnose patients. In the 60 years since that first publishing, the DSM evolved with making more categories and being more in detail, while also taking out the diseases no longer considered a mental disease. From the first DSM with 130 pages and 106 mental disorders, there was a large change where now the third DSM had 494 pages and 265 diagnostic categories. As time went by, there was new discoveries on diseases and differences between, and finding out how some that were once thought to be a mental disease turned out not to be. Then, from having 494 pages and 265 diagnostic categories, the latest DSM is currently consisting of 947 pages and many categories describing in detail the many different disorders. Almost as long as there's been a DSM, there has been a strong opposition to it. In the 1960s, psychiatrist Thomas Zatz was troubled with the DSM and challenging it by saying mental illness is just a mere myth. Since the third edition, there has been a strong question and concern with the reliability. Psychiatrists would disagree on a diagnosis and question which is correct. The earlier versions of the DSM were too general, and now there are so many diseases that it is harder and harder to tell apart. Little progress has been made toward understanding the pathophysiological progress and etiology of mental disorders. If anything, the research has shown the situation is even more complex than initially imagined, and we believe not enough is known to structure the classification of psychiatric disorders according to etiology, says editor Michael First in 2005. The Mind Freedom March. On Saturday, May 5, 2012, many protesters spoke out during a rally and then marched to the front of American Psychiatric Survival Annual Meeting in Philadelphia. The reason being to go against the DSM and stop psychiatrists from using what they call the label Bible. Dr. Kyle Arnold protested by giving a petition with 13,000 signatures from professionals at the reform for the DSM to change. He was quoted in saying, "The DSM-5 will recklessly assign psychiatric labels which will lead to further overprescription of dangerous drugs and more infringement on individual freedoms." Frank Blankenship, a former asylum patient/survivor, protests by blogging and in this protesting for rights against the DSM. He goes in front of office headquarters and still protests, as well as involved with many peace protests against the DSM. These are people that have insight and know the causes and effects of this book. There is also a website called NAMI that was made in order to spread awareness and to show others about protests against the DSM. A quote was given in saying that by doing this, we are letting the APA know we are all the media. These people protest because they know and have experience with this book and the harm/damage that it does and the book causes. Because of these protests, the APA has to think and have some second thoughts on the DSM and about the publishings. Although the 5th DSM was published, people are more aware. Now more psychiatrists are starting to question the DSM and using it, and everybody is able to see and fully understand the harm that is being caused. After all these years, the first step is finally being taken and letting all the people know about the DSM.